We go through over 400 menstrual cycles in our lifetime, over 400 cycles of changing hormones that affect our moods, our energy, appetite, sleep, productivity, how we carry ourselves, what we keep in our purse, and so much more. Yet, we don't really learn much about periods. In fact, in some parts of the world, like where I grew up, we learn nothing at all. I'm naturopathic Dr. Ann Hussain, and this is Phase to Phase, the Hormone Health Show. In today's episode, I'm taking you through what a normal menstrual cycle looks and feels like. The problem with a lot of menstrual education is that we learn a little bit of the science, what the different phases are, some of the physiology, but we really don't learn how that shows up in the body, how you might experience it. And especially not in an age-appropriate manner when you're able to receive this information and really embody it or take it and run with it. We learn it too young, and then we're left to flounder and learn things on the wild webs of the internet as we age. And if you are older than the age of, 35, then you probably were floundering through some blogs and some books, if that. So, today we are going to not only go through the science and physiology, but what a normal menstrual cycle actually looks like. And there is no one way to have a menstrual cycle. There is a range. I always joke that we learn about the periodic table and the elements, and we're, especially the first 20 elements, and we learn how to calculate the acceleration of a train from rest, but we really don't learn much about these bodies that we live in and this cycle that really influences so much of us and shows up in so many different ways. So if you've ever wondered, is my period pain normal? Should I get this assessed? Or heck, is my period normal? Or am I supposed to be bleeding this much? Or why are my poops so loose when I have a period? Then this episode is for you. We'll start off with going through what a normal menstrual experience can look like, and there is a range there, so you might not resonate with everything I'm saying, but I do want you to pay attention and reflect on your own menstrual cycle, why you need to care about your menstrual cycle, because it really does give you vital information about your health. And then we'll end off with how you can get a good pulse on your menstrual cycle and what to do with that information, especially if your menstrual cycle or your period problems are holding you back in life. Let's start with the period. Your period is actually the culmination of your previous menstrual cycle where you built up this lining because of hormone change. And then when the body realizes that, pregnancy didn't happen. So then your hormones drop. So your estrogen and progesterone both drop and they destabilize the lining. You mount this physiological inflammatory response, and then you get a period. So that's what's happening at the beginning of your menstrual cycle. Day one of your cycle is day one of your period. And this inflammatory response that you're creating is actually very normal and a very natural part of life. It isn't the same response that you get when you injure yourself, because when you injure yourself, there's likely a mark that's going to be left. In the uterus, there is no mark that's left, which is pretty cool. But you may feel some water retention or bloated feeling. You may feel heaviness in your vulva, for example. You might feel a little bit of discomfort. You may even have loose poops. And this is all a very normal part of having a period. However, if you're experiencing significant period pain to the point where you have to miss out on life, work, school, etc., or you have to take heroic doses of painkillers, if you have to use multiple management strategies, if you are just struggling, we need to investigate where that's coming from and support you so you can live your life. Now, when it comes to how many days you might lose blood, the average is around 3 to 5 days, but anything up to 7 days is normal. So you might lose a little bit more on those first couple of days, and then it tapers off. Now, quantifying blood loss is quite difficult, actually, when it comes to your period. The average menstruator will lose around 30 to 50 milliliters of blood, but that can range from 10 to 80 milliliters. Anytime we're going over 80 milliliters, we do want to investigate. That's considered heavy menstrual bleeding. Anything under 10 milliliters is called scant bleeding, and we also want to understand what's happening because there are conditions that can lead to both. So a good rule of thumb is if you're using an absorbent product like a regular sized tampon or pad, it holds around 5 to 6 milliliters. If you're using a cup or a disc, you should have volume markings, but most cups will hold around 20 to 30 milliliters of blood. Now, menstrual flow does contain not just blood, but also immune cells, cervical mucus, and some other compounds in there. And you might even notice clots. Small clots, like dime-sized or smaller, those are considered normal. However, if you're having clots that are an inch in diameter, so over the size of a quarter or a loonie, especially regularly, then that should be investigated. Most of the time, period problems, whether that is heavy bleeding, significant period pain, large clots, the most common conditions we're suspecting here are going to be endometriosis, adenomyosis, and fibroids. Those are the most common ones. So we don't want to not investigate you, and ultrasound can be a really helpful tool for us to assess. But you also need to understand how much blood you're losing. And to that point, you also want to make sure you're noting down the frequency of product change. So again, if you're using an absorbent product, every 2 to 3 hours is what we consider normal. Anything less than 1 to 2 hours is not normal. It's too frequent, especially if you're soaking through those products. So again, that would fall under heavy menstrual bleeding or abnormal menstrual bleeding, and that should be brought up with your healthcare provider. So that's your period. You're losing blood. So first day of flow is cycle day 1. That's how we count a menstrual cycle. And if we're talking about length, then an average length of a menstrual cycle, once it's been established, is around 24 to 35 days. It does not have to be 28 days. So 28 days is the average. And some people do really fall on that 28-day cycle or 28-day pattern, and that's completely fine. I don't fall in that pattern. My cycles are 31 to 33 days, somewhere in there, and that's very normal. An irregular cycle is when you have significant variability in the length of your cycle. So for example, when I was growing up, I have a history of PCOS or polycystic ovary syndrome. When my cycles were not well managed, when my PCOS was not well managed, I used to have cycles that were sometimes 30 days, sometimes 45 days. Then it would go missing for months, and then it would be 45 days. So it was all over the place. That's what we consider irregular. But a 1 to 3 day deviation is completely normal. Not just that, your cycle length can actually get affected by the things that are going on in your life. Your whole menstrual cycle can get affected by the things that are going on in your life. Stressors of any kind, so that could be a physiological stressor, that could be a mental emotional stressor, that could be a physical stressor. All of these things can show up in your menstrual cycle. So for example, if you just started a new medication, then your period may be a little bit late, or maybe it may come a little bit sooner, or maybe you notice some changes in your premenstrual experience or in your flow. That's actually a normal experience. Not everyone will respond in that way. We all have different thresholds at which our cycles will get thrown off. Mine gets thrown off fairly easily, I would say. So anytime I get sick with any kind of infection, and if that infection has happened before I ovulated, then what's going to happen is my ovulation is going to be later and my period is going to be later. Because the thing that dictates the length of your cycle is ovulation. Once you ovulate, you're going to get a period around 2 weeks later. If you ovulate irregularly, you're going to have an irregular cycle. If you ovulate a little bit sooner, you're going to get a period a couple of days sooner. So ovulation is really the thing that is going to dictate how long your menstrual cycle is. And ovulation can be sensitive to even resource availability, which is why stressors can change your menstrual cycle. So in my case, when I get sick, my cycle gets delayed because ovulation gets delayed. My body is utilizing its resources in a different manner while I'm sick. Same thing happens if I'm really stressed out. And when I travel, actually, I see it all the time. So when I'm traveling, I typically have a higher burden of responsibility before I leave. And then I'm trying to leave. And then when I go, my schedule is off. And then when I come back, my schedule is off. And that really throws my menstrual cycle off for a loop. I went away in May of this year, and my menstrual cycle was, instead of being like 30 to 32 days, it was actually 50 days. And I know that as my normal, so I don't panic about it. I just carry on, and then the cycle after that was absolutely normal. So most of the time, we don't need to intervene. We just need to carry on, and the cycle will typically follow. If you're seeing persistent change, though, that your cycles used to be 28 days and now they're 40, 45 or irregular, then we do want to investigate. If your blood flow used to be 7 days and now it's only 1 day consistently, we do want to be investigating that. So that's how we determine whether we should be taking a look at something more specifically or not. Like, what's the trend over time? Because the odd time you have a menstrual cycle change, it's not a problem for the most part. Now, let's get back to the menstrual cycle itself and what's happening in that follicular phase. So, as you're menstruating, what else is happening in the background is your estrogen is going up because that's what builds up your uterine lining. It's estrogen. The other thing that's going to happen is you're going to start making a little bit of cervical mucus. So, the cervix makes mucus in response to estrogen, and there's no correct amount to be making. And oftentimes, the cervical mucus at the beginning of a cycle or in the first half of the cycle can first look like a little gummy or a little thick or opaque or off-white or clear. All of those things are normal. Sometimes I have received patients in my clinical practice and they're like, every month I get this discharge. I went to my doctor and we've done swabs and we've done all the things and it even has a distinct odor to it. And I don't know what it is. Like, is it bacterial vaginosis? Is it candida? Like, what is it? And after further investigation, I end up realizing that this person is describing very regular cervical mucus. So we track it for a little while longer. And lo and behold, it's happening in the mid-cycle in a higher quantity. And then it goes away and then it comes and then it goes. So having cervical mucus is actually a very normal part of the menstrual cycle. Don't be alarmed by it. We just don't learn about it. If your fertility track, you likely are really, really, really honed in on it because it is a sign that, is telling us about ovulation or ovulation is coming. However, most other people have not really either paid attention to it or known about it. So it can be a little bit alarming when you start paying attention to your menstrual cycle. Now, as we approach the middle of our cycle, estrogen rises and cervical mucus typically rises as well. Estrogen needs to reach a particular threshold to trigger ovulation. And ovulation is that point where we release an egg from a follicle. And the estrogen, when it reaches a certain threshold, it triggers our hormone called LH, or luteinizing hormone. And that's the thing that's going to go tell our follicle to release the egg at ovulation time. You have a bunch of follicles that have been growing in the background, and one of them is selected as the dominant follicle. And this is the one that will rupture at ovulation time and release an egg. In the follicular phase, people feel fairly well in the sense that they feel a little bit more resilient. Their period is over. Now they have a little bit of energy as estrogen is starting to rise. That's a fairly less symptomatic time for a lot of people post-period. And as ovulation hits, though, some people can experience a little bit of what we call Mittelschmerz. So Mittelschmerz is German for middle pain, and it's ovulatory pain, essentially because of the hormone change and the egg being released. You may have a little bit of pain, and that could be intermittent throughout the day. That could be like a couple of twinges. That could be something else, but typically happening in the lower abdominal region somewhere, and generally speaking will last around, a day or so. Some people, however, if there is an underlying structural condition or an underlying condition of some kind, like endometriosis, like fibroids, you may get more pain, you may get spotting, you may get other symptoms also. And the severity of the symptoms is really what should be raising alarm bells, at least they do in my clinical practice, for us to investigate a little bit further what's going on. So that's ovulation. Ovulation time typically is happening around mid-cycle, but it could happen a little bit sooner, a little bit later for you, depending on how long your cycle is. So for example, in a 30-day cycle, typically ovulation is happening around cycle day 15 or 16. Now, after ovulation, what happens is that we have an increase in both our sex hormones, estrogen and progesterone. And the luteal phase, we can really divide it into the first half and the second half. Some people feel fairly well in that first half of the luteal phase, so the first few days or the first week after ovulation, and will be more symptomatic in the second half as the body realizes pregnancy didn't happen and your hormones start to drop. Some people feel unwell throughout that whole time, and some people aren't really impacted so much by hormonal fluctuations at all. Some of us have genetic predispositions and stresses or trauma from the past that really influence how we experience this part of the menstrual cycle. So for example, if we take people with PMDD or premenstrual dysphoric disorder, where there is extreme volatility in emotions, there can even be suicidal ideation as a result of hormone change. which can be very alarming. And these people tend to feel better with a period because the hormone change that comes along with the beginning of a menstrual cycle actually offers relief. So we can experience this menstrual cycle change, this hormone change in the second half in very different ways, but a normal range that is not stemming from a condition of some sort would include, let's say, a change in appetite. Oftentimes people feel a little bit hungrier, and that can show up as cravings sometimes, especially if you're someone who doesn't have a lot of fuel in the morning and tends to eat at night. You might get all your hunger cues later in the day. If you are someone who is super stressed out, that might show up in this part of the menstrual cycle as a little bit more volatile. But going back to a normal experience, these are some of the things that you might see. A little bit more fluid retention or bloating, a little bit of sluggish bowels because of hormone change, a little bit of an increased appetite, a change in metabolism. Maybe your body temperature is a little bit warmer. So because of progesterone production in the second half of a menstrual cycle, our basal body temperature does go up by a little bit, but combined with that is fluid dynamics. So how our electrolyte systems and our water systems are working. So we might actually get a little bit overheated before we sweat. So you might actually need more water in this time of the menstrual cycle. And then because we experience some of these changes, our behaviors might also change. So for example, you might be eating more salt, you might be eating less vegetables, you might be drinking more coffee to get yourself going, and then you might be unwinding with alcohol. All of these things can worsen some of those premenstrual things that are within normal range to being not in normal range. So if we take a look at PMS or premenstrual syndrome, which we experience in that part of the menstrual cycle, some of the things that make it worse are alcohol, high consumption of caffeine, low plant foods, high salty, sugary foods, lack of exercise. So it's a combination of what's going on in life and what our behaviors are, and also what the hormone change is doing and making us feel. So the luteal phase can really look like a lot of different things, but there are some variations that are happening, and it's because your hormones are changing. That's just a natural fact. And sometimes when we're younger, our bodies are more resilient, and sometimes when we're younger, we don't feel them as much. As we approach our 30s, get into our 30s, we might feel them more, and that's a product of chronological aging, perhaps paying a little bit more attention to your body and taking charge of your health, perhaps even, and then also changing priorities and a bunch of other things, right? So I sometimes feel like people are like, well, this didn't used to happen before, and now I'm experiencing it. Some of it could be that we are actually experiencing it when we didn't before. Some of it is that the resilience of our bodies is changing, and that could be a product of a lot of different things. And then some of it could be that we're paying more attention to it. And I think most of the time it's all of the above. So I do want you to pay attention to your menstrual cycle. And this is this next part that we're going to get into. Your menstrual cycle is going to show up in a variety of ways. And the only way to get a pulse on it is by paying attention to it, right? Like you can't understand your trends without actually paying attention to it and maybe tracking it. Tracking is how I got a pulse on my menstrual cycle. It's how I realized that my cycle was so wonky, because for me, irregularity was normal, and no one had taught me that irregularity was not normal. So I just didn't know. It wasn't until I learned a little bit of biology, I learned a little bit of menstrual physiology in university, that I was like, oh, my menstrual cycles are really irregular, and this is why. So the menstrual cycle really can look like a lot of different things for all of these reasons and more. Your genetics, your history, what's happening in your life, what other medical conditions that you have, all of these will play a role. And the only way we can identify those nuances is by tracking your menstrual cycle. It's how I learned about my menstrual cycle. It's how I learned that my cycles were irregular. And the thing is that I had normalized irregularity for myself because I knew nothing else. And my mom had also had irregular cycles, so she didn't make much of it either, right? Like my mom's not a doctor. She didn't study the human body. For her, irregular cycles were the norm. So she figured that my irregular cycles were also the norm, especially because I came out of her. Right? So we normalize a lot of things for ourselves. And the reason why we need to care about the regularity, the reason that we need to care about your menstrual experience is that it tells us about your resource availability. Like, do you have the resources to mount a menstrual cycle? Because if you're someone who's underfueling or you're overexercising and underfueling at the same time, and we see this a lot in athletes, and we also see this a lot in eating disorders, where because we don't have enough resources to mount a menstrual cycle, and the menstrual cycle is not so important for your survival, we see this downregulation of your menstrual cycle because your body is utilizing resources for survival first. And then once we get to a different place, it can be reactivated. For a lot of us, tracking is the way we can identify your patterns and also identify if there's room for improvement or there's something else going on. That's the true importance of tracking. It also tells us if you're ovulating or not in many cases, or if you're ovulating irregularly or not. So we do need to care about your menstrual cycle. And tracking also allows you to have a report card over time because there will be times of change. So when you start a menstrual cycle for the first time ever, called menarche at around puberty time, we do expect a little bit of irregularity, but that should resolve typically on its own as your body learns the menstrual way. And then you're in your sort of prime reproductive years, especially in your late teens, early 20s, and your late 20s as well. And then you might start noticing changes as life, chronological aging, and everything else in the environment starts to compound. And then as you approach perimenopause, things will change again. If you got pregnant in the middle or were breastfeeding, that will change things. If you were on contraception, that will change things. The only way we can really get a pulse, though, is by tracking. And when you track, here's what I want you to remember. POOP, or poop. We're talking about poop a lot today. So that acronym really stands for period. What is happening in your period? And if you're new to tracking, even just writing down the first day of your period is a good place to start. But really, we do want to know how much blood are you losing? How many period products are you using? That sort of thing. Do you have pain? How are you managing it? And how long does it last? O for ovulation. So are you noticing cervical mucus changes? Are you noticing anything else like pain at ovulation time or anything like that? The second O is for other. So this is a good opportunity for you to put anything that might be of concern to you. So if you get headaches or migraines, if you get acne that is intermittent, if you get insomnia sometimes but not at other times, this O, you can really track it over your menstrual cycle, whether it's hormone related or not hormone related. You'll find out if there's a cyclical pattern or not. Either which way, it gives us information that we can utilize, especially in a healthcare setting. And the last P is for premenstrual experience. What are you noticing before your period? Is it really getting in the way of life? Because if we look at a diagnosis like PMS or PMDD, these are diagnoses we make based on your experience, not blood work. So you tracking your cycles over time is the thing that is going to lead us to the diagnosis and also be able to help you. So tracking is really, really important. Apart from helping you calculate your cycle length, it helps you understand your body. It provides pregnancy prevention and fertility data, helps you be specific in your healthcare communication, and helps you advocate for better care. Now, the other thing that will influence your menstrual experience are the very foundations of your life. So, for example, screening blood work like vitamin D, iron, thyroid, and maybe B12. Because if these things aren't up to par or these things are off, then you might actually notice your hormonal fluctuations a lot more. Even your lifestyle habits like sleep, stress management, doing the things that you love, connecting with the people that you love, physical activity, diet, all of these things actually, if utilized properly and if they're solid in your life, can dampen the irregularity in response that you get to your hormones, meaning that you might experience hormone change in a different manner, in a better manner compared to someone who doesn't have those things in place. So the foundations really matter when it comes to how you experience your hormones. I always say when you support your hormones can support you. And that's really what I mean by that. When you have the foundations in place, you likely will have less volatility in how you experience those hormones. That's not to say it's the only thing that helps, right? You might still have severe fluctuations in that, but they do have a very supportive role. all your tracking data and understanding your menstrual cycle and what you can do with your menstrual cycle information is really advocate for yourself. And when you're talking to your health team, you can actually summarize a lot of data in a short period of time. For example, you can say, on the first 2 days of my period, I soak through a super pad every 90 minutes, have multiple clots bigger than a quarter. I have to take 4 extra strength Advils, and that only helps reduce the pain by 50%. And it impacts my ability to go to school or work, and I'm grumpy and irritable. It affects my day-to-day life, right? It takes you only 15 seconds to communicate all of that information. And if you track it, you can actually go in prepared with your questions and really emphasizing the impact on the quality of life and the numbers. The numbers really matter when you go in and talk to your healthcare provider, because as you know, if you're going to see your family doctor, you have a short period of time to talk to them, and you also want to get a proper assessment. I find that also sharing your family history, if there is any related family history, can tip the scale. So please, if there's any relevant details that you need to reiterate, because ultimately you live in your body, you're the expert on what is happening in your body, and that information is really important. If your doctor doesn't want to investigate further, then you can ask some pointed questions. Is there any testing that we can do, like an ultrasound or blood work? Should I be getting a referral to a gynecologist or endocrinologist? What should our next steps be? If we're waiting and watching, how long do we wait? How long do I watch? And if still we're not getting to a diagnosis, then perhaps ask the question, could this be endometriosis? Could this be fibroids or something else? This is how we can utilize menstrual cycle tracking information to help you get the care that you deserve. You can actually be more accurate and more succinct in your communication, which is amazing. That's how I got to my diagnosis of PCOS as well. I tracked my cycles. I noticed my symptoms. I was put on the pill, didn't tolerate it well. I went back and asked these questions. It did not come easy to me, I'll be very honest with you. I'm not very good at asking questions, especially when I was younger. Even now, sometimes speaking up can be difficult for me and for a lot of people. So you're not alone in that, but practice and going in prepared really is the thing that sets a lot of people for success, including myself. And oftentimes when I'm working with patients and I need to send them back to a medical doctor, I will write out the prompts for them. I'm experiencing XYZ. Do you think it could be this? So as we end this episode, I want you to remember that your period should not be something that you're just surviving every month. You don't have to love your periods, but you shouldn't be suffering through them. It happens, and we do want to make sure that you're well supported through it, or as well supported as can be. If your period is running your life instead of the other way around, it really is time to find a healthcare team who will take your symptoms seriously and really give you the care that you deserve. And remember, there's a whole range of treatment options out there if you are struggling with your menstrual cycle problems or if you have a diagnosis, ranging from medications and hormonal contraception to herbs and supplements and acupuncture, lifestyle, nutrition, etc. We have to find the right fit for you. And I would arguably say the lifestyle component and the stress management component always needs to be there because it is crucial for not just your menstrual cycle, but your overall health. But some of the other things that we layer on will depend on you, your age, what's happened, what you've tried, what your values are too, and what your goals are. So make sure you are bringing them up with your health team, whether that is a medical doctor, whether that is a nurse practitioner, whether that is your acupuncturist or naturopathic doctor. And ideally, you do have a team of a few different people. The key really is to find what works for you, your body, and your life. So I hope you'll pay more attention to your menstrual cycle and track it, not freak out the odd time it is off or weird. And share this episode with other people who will benefit from learning this, because the more we learn, the more we know, the more we talk about it, the more we can dispel the stigma, because I really am on a mission to have menstruators and women thrive. We have too many people being held back by their hormonal problems and their menstrual cycle issues, and we can't have that anymore. Make sure you grab a copy of my book, The Period Literacy Handbook, wherever you get your books. We'll throw some links in the show notes for you. Thank you so much for being here with me at Phase to Phase. Make sure to subscribe and follow wherever you get your podcasts or at phase2phase.ca.